Assalamu alaikum. Now I would like to discuss about the difference between transverse myelitis and GBS. Okay, what happens in transverse myelitis? In transverse myelitis, early flaccid paralysis, later spastic paralysis. But in Guillain-Barré or Guillain-Barré syndrome, Guillain-Barré, there is ascending paralysis, weakness in the lower limb mostly, then the upper limb in the earlier disease. And in transverse myelitis, if quadriplegia, weakness both in lower limb and upper limb equally, but in GBS, lower limb is more than the upper limb. In transverse myelitis, there is clearly identifiable sensory level, but in Guillain-Barré, there is mild sensory loss, no spinal cord level. In transverse myelitis, there is bowel bladder dysfunction. In Guillain-Barré syndrome, there is cardiovascular instability. Cranial nerve involved in transverse myelitis. There is no cranial nerve involved in transverse myelitis, but in Guillain-Barré, there is oculomotor, glossopharyngeal, or facial paralysis. Oculomotor, glossopharyngeal, or facial paralysis. In EMG or nerve conduction study, mostly normal in transverse myelitis, but peripheral motor or sensory nerve conduction is reduced in Guillain-Barré. MRI, focal enhanced area of T2 signal, focal enhanced area of T2 signal on MRI in transverse myelitis, but in Guillain-Barré syndrome, it is normal. Enhancement of anterior nerve root or chordae igna. CSF fluid pleocytosis with increased IgG index, and in Guillain-Barré, there is absence of pleocytosis and elevated protein. So, four things first: motor, sensory. In motor, in motor, there is early flaccid, late spastic, but Guillain-Barré with ascending paralysis, Guillain-Barré quadriplegia, more. There is no upper limb, lower limb discrepancy. All are equal when it is involved. Weakness is equal in both lower limb and upper limb. Sensory in transverse myelitis, there is specific identifiable sensory level, but in Guillain-Barré there is no sensory level, no spinal cord level. In autonomic bowel bladder dysfunction in transverse myelitis, but in Guillain-Barré it's cardiovascular instability. And in cranial oculomotor glossopharyngeal or facial paralysis happens in Guillain-Barré, but not in transverse myelitis. EMG mostly normal, and in Guillain-Barré there is peripheral motor or sensory nerve conduction is reduced. MRI, a focal enhanced area of T2 signal, but in Guillain-Barré there is enhancement of anterior nerve root or chordae igna. In CSF there is pleocytosis with or without increased IgG index, and in Guillain-Barré syndrome there is absence of pleocytosis and elevated protein. And that's all about transverse myelitis and GBS. Hope you enjoyed.